Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHE, the Collaborative for Health and Environment. We invite you to put a note in the chat introducing yourself if you'd like to. I'm going to start with a few bits of housekeeping. CHE is a member group of the EDC Strategies Partnership, which is bringing you today's webinar. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, a program of environmental health sciences, the Biomonitoring Resource Center, and the Health and Environment Alliance, or HEAL. If you'd like to download today's slides, you can find them on the webinar page on our website at healthandenvironment.org, and we'll put that direct link into the chat now. We'll disable the chat during the presentation, but please do type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentation. If you'd like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar is being recorded and it's scheduled to last for 45 minutes. With that, I'll hand it over to today's moderator, Jerry Heindel, Director of HEEDS. Jerry?
Thanks, Rachel. Happy New Year, everyone, and welcome to this very exciting webinar today. Our speaker today is Jane Muncke. Jane is the Managing Director and Chief Scientific Officer at the Food Packaging Forum. And that's a foundation that provides independent and balanced information on issues related to chemicals in food packaging and other food contact materials and their impact on health. She holds a doctoral degree in environmental toxicology and a master's in environmental science from the Swiss Federal Institute of Technology. And during her graduate work, she was trained in analytical chemistry and later in endocrine disruption screening in zebrafish. She then joined Emhart Glass, a supplier company to the container glass industry. And there she analyzed scientific information on food contact materials, migration, and human and environmental health impacts. That led her then in 2012 to found the Food Packaging Forum. And as managing director, she provides information on chemicals in all food packaging materials and their potential impacts on health. If you're unfamiliar with the work of the Food Packaging Forum, take a look at their website. It's an awesome resource on thousands of chemicals in food packaging and how they leach into food and can cause health problems. Today, she's going to focus on her recent publication, A Vision for Safer Food Contact Materials, Public Health Concerns as Drivers for Improved Testing. Thanks for joining us today, Jane, and I turn the webinar over to you.
Thanks so much, Jerry, and hello, everyone. And thank you especially to the hosts for this kind invitation and for this opportunity to share some thoughts with you on chemicals in food contact materials and how to ensure that these materials really are fully safe. So let's start at the beginning. This is food, or at least these are some ingredients we can use to produce human food. You can do this yourself in your kitchen, or you can go to the grocery store and buy already processed foods like these cans or like these juices. But regardless of whether foods have been factory processed or processed at home, foodstuffs always come into contact with food contact materials. So why should we care about food contact materials? Well, because chemicals migrate from food contact materials into foodstuff. This process is known as chemical migration. And what you can see here is a blow-up of the packaging food interface. And you can see here some small dots which represent small molecules, so chemicals that make up the food packaging material. And these small dots can transfer into foodstuff. This transfer of chemicals from packaging into food is what we call migration. And this is a well-known phenomenon, and there are decades and decades of scientific evidence documenting it. So back in 1958, it was already known that chemicals transfer from packaging into foods. And this is when the US Food and Drug Administration, the FDA, was given its Food Additives Amendment, a regulatory act that deals with food additives, including the so-called indirect food additives, which are those chemicals that migrate from food contact materials into foods. So this was almost 66 years ago. And one could think, great, something less to worry about. The FDA has this under control. It's all being regulated and it's been taken care of. But unfortunately, this is not the case. In fact, we at the Food Packaging Forum in 2014 already published a study showing that there are several hazardous chemicals that are permitted to be used in food contact materials, including food packaging materials. And this here was an illustration made by a US civil society group in response to our study, stating that 175 harmful chemicals could be leaching into our food from food packaging. So before I go on with the story of hazardous chemicals in food packaging, I just want to clarify some key terms here, because maybe you're starting to get a bit confused with all this technical language. So when I speak about food contact articles, what I mean is food packaging, but also food processing equipment, kitchenware or tableware, and so on. Any product that is intended to be brought into contact with foodstuff, be that solid or liquid food. And in this example here, this innocent yogurt cup is actually a highly engineered object because it consists of several different distinct what we call food contact materials, like a plastic cup, an aluminum lid, a coating on the aluminum, adhesives to glue the lid onto the cup, printing inks on the lid and on the cup, and so on. But what we're really interested in here and what we're focused on today are the food contact chemicals, or FCCs. These are any and all chemicals that are present in the finished product, including the intentionally used chemicals to make the food contact material, like the monomers, the additives, and so on, as well as the non-intentionally added substances, which are impurities, reaction byproducts, and degradation products. So, for example, degradation products of the additives or of the polymer. So all of these chemicals here that make up the food contact materials and articles, we call them food contact chemicals. And just a quick remark, this is a term that we made up. It's not a legal term. So now we can ask, how many food contact chemicals are there? And our work here at the Food Packaging Forum for the last few years now has been to compile an inventory, and to date we know of about 16,000 food contact chemicals. These include mostly those that are intentionally used to make food contact materials and articles. And of these, for at least 1,822 chemicals, there's empirical evidence from lab studies, peer-reviewed studies mostly, that they migrate from food contact materials into foodstuffs. But this is only what is known. And in fact, there are many unknowns, and experts estimate that there may be up to 100,000 different food contact chemicals that are possibly migrating into foodstuff. The estimate is that for each intentionally used chemical, there are 4 to 10 non-intentionally added chemicals, which will also be present in the finished product and which can also form chemical reactions. Just very briefly, to put this into perspective, when we compare pesticides that are known food contaminants to food contact materials, we see that the number of substances for pesticides is around 1,500. Their level of food contamination is in the part per billion range, and there's robust toxicological evaluation. On the other hand, for food contact materials and their food contact chemicals, the number of substances is up to 100,000. The level of food contamination is in the ppm range, so up to milligram per kilogram food, and there's mostly no toxicological evaluation. This means that food contact materials are an underestimated source of chemical food contamination. So back to our work at the Food Packaging Forum, we've put together a database called the FCC Migrate. And the FCC MIGEX database informs about food contact chemicals that have been measured, either in migrates or in extracts or both of food contact materials and articles. So these data are from empirical studies, which we systematically searched, reviewed, compiled, and extracted the relevant information from. And this resource is freely available on our website, and you can find links to all primary publications from where the data originated there too. So I invite you to access that. Using the FCC MIGEX and another data set on intentionally used food contact chemicals, we then asked, which are the food contact chemicals of concern that we know of today? So this was kind of an update of our 2014 study. And this time in 2022, we found that there are at least 388 food contact chemicals of concern that are legally and lawfully used in food contact materials and articles. And as you can see, there are many carcinogenic, mutagenic, and toxic for reproduction chemicals, the CMRs, but we also have some EDCs. Of course, bear in mind that only very few chemicals are tested for EDC properties, so likely there will be a few more if one would systematically test all of these. And for about 100 of these known hazardous chemicals, we have empirical evidence that they migrate into foodstuffs. So that is concerning because it means that people are indeed exposed to these hazardous chemicals. Now, you're probably thinking about the FDA and that there is the Food Additive Amendment of 1958, which should prevent exactly such exposures to hazardous chemicals from food contact materials. So what is the legal definition of indirect food additive safety in the US? Safe or safety means that there is a reasonable certainty in the minds of competent scientists that the substance is not harmful under the conditions of its intended use. That's it. Quite clever, actually, this definition, because it is timeless and it should adapt with the changing scientific understanding, one would think. But unfortunately, this is not the case. The safety understanding has not kept pace with the science. And a few years ago, we published a very detailed analysis of why the current chemical safety assessment of food contact materials as practiced in the US, in Europe, and actually everywhere else in the world is not based on modern science. And I will go into some more details in a moment. But importantly, about 1 year ago, the US Government Accountability Office also published its own report into food additive safety assessments at the FDA and concluded that there may be a health risk. So confirming what we've been saying, current regulatory practices do not sufficiently protect human health from these hazardous food contact chemicals. Why? Because as I've shown you, it's clear that chemicals migrate from food contact materials into foodstuff. And we do know that some of these chemicals contribute to chronic diseases in the entire human population. So what's the evidence for that? There are some examples like the issue of male infertility due to declining sperm counts. This is the work started decades ago by Neil Skackerbeck and colleagues in Europe, and then later on continued by Shanna Swan and her colleagues in the US and in Spain and so on, who show this decline at a global level and who plausibly linked certain chemicals like the phthalates to this phenomenon. And indeed, phthalates are still very much present in food contact materials and they migrate into foods. There's plenty of evidence for this in the FCC MIGEX, if you want to look for that. Then we also know that chronic diseases are increasing globally. Of course, not all of the disability-adjusted life years that you can see here on the y-axis are associated with chemical exposures because these chronic diseases here are multifactorial and their causes can vary. But some of the causes can plausibly be attributed to chemical exposures, which in a way is good because it makes a strong argument for preventing such exposures. Of course, it's not good that these chemicals cause these diseases in the first place. So in 2020, we published this scientific consensus statement on the impacts of food contact chemicals on human health, where we summarize these facts and others and showcase the areas needing more attention in terms of research. And we also highlight some appropriate steps for policymakers in the area of testing and improving the safety assessment to make sure that food contact materials are not a source of hazardous chemicals migrating into foods. So what do we see as the way forward? So in a nutshell, I think that it is to use modern science, because that is not happening right now. Current regulations are very, very outdated, and they don't do justice to the tremendous amount of scientific knowledge and evidence that is available today with regards to chemicals and their impacts on health. Or to put it differently, to prevent illness, you have to test all food contact chemicals for their impact on increasingly prevalent chronic diseases. This is our vision at the Food Packaging Forum, and we expanded on this in detail in this recent publication where we put the public health concerns front and center. So what exactly do we call for? And I want to walk you through some of the details here. So first of all, I think I can't really overstate that current regulatory requirements for assessing the safety of food contact articles are insufficient, they're outdated. Right now, chemicals are tested as single substances that are intentionally used to make food contact materials, and the focus of this testing is on cancer as a proxy for all chronic diseases. That's the current thinking. Other diseases are not targeted at all right now. And in the US, I have to say, not even all intentionally used food contact chemicals are actually empirically tested, as there is the threshold of regulation exemption, which assumes that very low chemical exposures are not harmful if a chemical is not considered a mutagen. So for these chemicals, you don't even have to test right now. But as we know, it's a fallacy to equate low levels of chemical exposures automatically with safe levels, especially for endocrine disrupting chemicals and also for chemicals when they migrate as mixtures from chemically complex materials such as can coatings or plastics or even printed papers or recycled paper. And it's also a fallacy to assume that cancer is the most relevant chronic disease and that it's a proxy for all chronic diseases when other types of chronic diseases are more prevalent, such as cardiovascular diseases or metabolic diseases, like especially in the US. So what we did then was we decided to cluster the most prevalent and relevant chronic diseases, and we came up with the 6 clusters of disease concept, or the SCOD. And the 6 disease clusters are cancers, cardiovascular diseases, reproductive disorders, brain-related disorders, immunological disorders, and metabolic diseases. All of these disease clusters are increasingly prevalent globally. And for all of these disease clusters, there are plausible links to chemical exposures. For many, exposures, especially during fetal and perinatal development, are of most concern, but for some also the chronic exposures during adulthood are concerning and associated with these diseases. And we hypothesize that preventing exposures to chemicals that are associated with increased disease prevalence will lead to a reduction in this disease prevalence. So this basically is an excellent opportunity for preventing exposures, for example, from food contact materials. So our vision is to have only fully safe food contact materials and articles. And these articles that are tested, they're tested very differently than it's done today. So in our vision, we will test all the migrating chemicals. So we'll test the single substances that are intentionally used, but also everything that is migrating from the finished food contact article as a mixture. And we will test the chemicals for their impacts on the 6 clusters of disease. So not only for their probability to cause cancer, but also their propensity to cause any of the other diseases in the 6 clusters. So in short, fully test all migrating food contact chemicals. And you can see this in detail in this illustration here, how we propose to do this, namely using suitable in vitro screening assays combined with effect-directed chemical analysis, where the goal is then to identify the migrating chemicals and to weed out those chemicals that indeed have the hazardous properties of concern. So the question now is, how can we confirm food contact chemicals are fully safe? And obviously, the exact types of testing that are done will be very critical. And indeed, there are different approaches to identifying chemical hazards. So in traditional toxicology, the question typically asked is, for example, does a chemical cause cancer? And the testing is typically done in vivo using animals and over a rather long duration of time. And then the animals are examined for evidence of cancerous tumors. This means tests are very expensive, but they are fairly robust. However, as you know, there's a strong societal push to avoid animal testing, which is why novel approach methodologies, or NAMs, are increasingly being used also in the world of food contact materials, where this is actually already quite common. So another increasingly popular approach is the adverse outcome pathway, or AOP, where the guiding question then is, how does a chemical cause breast cancer, for example? So very specific and very focused on the exact molecular mechanisms, trying to establish a cause-effect relationship. This can be extremely time-consuming, but once it's been established, it's very useful for the development of relevant in vitro assays that you can use to screen chemicals. But you do need to invest a lot of effort into understanding the exact and detailed molecular pathways of how a chemical causes breast cancer, for example, something that can take decades or more of work. And then finally, I want to show here the fairly new concept of the key characteristics, where the guiding question then could be, does a chemical have the key characteristics of carcinogens? So this means that it is known what molecular properties make a chemical cause cancer. And these traits are well characterized, even though maybe the exact molecular mechanism, how a chemical causes a cancer, may not be known. But because a confirmed carcinogen's molecular properties are well known, one can then test other chemicals for the presence of these molecular properties and then establish whether these other chemicals are likely to be carcinogenic too or not. So the key characteristics concept lends itself very well to the use and development of in vitro screening assays. And we're suggesting with our vision to use both available AOP assays as well as key characteristic-based assays for screening of food contact chemicals. So I thought I'd show you some examples of key characteristics that have already been defined for some of the 6 classes of disease. And these here are the key characteristics of carcinogens, which were the first to be described back in 2016 by Martin Smith, Kate Guyton, and others at the United Nations International Agency for Research on Cancer. And they really are the pioneers of this concept. So for carcinogens, there is a wealth of data available on chemicals that are known to cause cancers in humans and animals. And so building on this available evidence, these here are the 10 key characteristics of carcinogens. So a chemical that is electrophilic or can be metabolically activated, is genotoxic, alters DNA repair, or causes genomic instability, and so on. You can also see here number 7, a chemical that is immunosuppressive, which also relates to another of the disease clusters, namely the immunological disorders. So for the immunotoxic agents, the key characteristics have also already been described, namely by Dori Jermolek and colleagues in 2022. And here you can also see some key characteristics that are relevant for the carcinogens, like number 4, chemical alters proliferation, and number 9, alters the cell death process. But you also see number 3 here, chemical alters signaling, and that's of course also a key characteristic for endocrine disrupting chemicals, or the EDCs. So let's look at these briefly. The key characteristics of the endocrine disrupting chemicals were described by Michel Lamarille and colleagues in 2021. And again, there are some overlaps with key characteristics of carcinogens and immunotoxic agents. and also with other key characteristics. So here's an overview of all key characteristics that have been published to date. You can find this on the keycharacteristics.org website. And you find all the publications that are relevant there as well. And a couple of the key characteristics, like for metabolic disorders or for brain-related disorders, are currently under development. So in short, there's a lot of really useful modern science available that should be used for identifying suitable, relevant in vitro assays that can then be used to test all food contact chemicals and materials for their molecular properties. For example, whether a chemical can activate a hormone receptor, whether it alters proliferation, or whether it's genotoxic, and so on. And importantly, for some of the key characteristics, suitable and relevant in vitro assays still need to be developed. So some more work is urgently needed in this area. So now I'm coming back to our Food Additives Amendment Act of 1958. And clearly, a lot has happened in the last 66 years. And I'm not saying that the FDA's regulations no longer are valid, to the contrary, actually, but they need a bit of refreshing and bringing into the 21st century. And that also means that the definition of safety needs to be revisited. In my mind, we should speak of fully safe food contact materials, and that should mean that using modern science, these materials are tested for all migrating food contact chemicals impacts on all relevant chronic diseases. So using relevant in vitro assays, such as those developed for AOPs, or maybe even more simpler, those in vitro assays that test chemicals for their key characteristics of toxicants. In my mind, actually, the key characteristics approach, even though it's hard to pronounce, has the potential to simplify and speed up development significantly. But it's clear that a lot of work still needs to be done. And the next steps towards fully safe food contact materials could be to first identify suitable in vitro assays, of course, but also to refine the already existing protocols for food contact materials sample preparation. This is not trivial, but there's fortunately quite a lot of work already done in this area and still ongoing, for example, in the labs of Marie-Christine Chagnon in Dijon in France, or Jean-Baptiste Fini in Paris, and of course also work that's been done at the Danish Technical University by the team of Anne-Marie Vingard and many, many others. A lot of people have been working on this, including food brands like Nestle. And of course, adapting the suitable in vitro assays for high throughput testing. That's another important step. It sounds trivial, but it's quite a big task. Then some new in vitro assays will need to be developed, and also improvements in the analytical chemistry are necessary so that chemicals with hazard properties can also be properly identified. Remember that there are many, many unknown chemicals that are potentially migrating from food contact materials. And for these, currently, no safety assessments are possible right now. And last but not least, there needs to be active and constructive collaboration between the different stakeholders, including, of course, the food and food packaging industry, regulators, academics, experts, and civil society. And also, I want to highlight here the scientists in the scientific services industry. Notably, those working in testing labs where such samples would be analyzed commercially. And in fact, I think this is a really important aspect, and I would very much like to collaborate, especially with those labs, and support them to build the relevant capacity so that the relevant testing using this modern science can be commercialized rather sooner than later. I think there's still quite a big gap, especially in the US in this area. And then finally, and eventually, it will be necessary to adjust the regulatory definitions and requirements. This has also been laid out somewhat in the recent government accountability oversight report that we spoke about briefly before. So yeah, there's quite a lot of room for improvement, biggest room in the world, and quite some potential for better protecting public health here. To conclude, I showed you that food contact materials as source of man-made synthetic chemicals are currently underestimated, but that preventing these exposures can likely significantly contribute to better protecting human health and reducing chronic disease burden. We also briefly touched upon currently inadequate regulations which do not require appropriate testing of food contact materials right now. And I suggested that modern science should be used instead to test all migrating food contact chemicals and to test them for all relevant properties that are associated with increasing prevalent non-communicable diseases. For example, using the key characteristics concept and working with the knowledge and the tools developed in the context of AOPs. And importantly, to robustly and holistically address this issue, there is a collaboration imperative, meaning that all stakeholders need to get together and fix this together so that food contact materials can be made fully safe. And I'd like to leave you with a quote from our very dear friend, Dr. Pete Myers, who stresses that if you don't test, you don't know. But this is the reality today. We assume food contact materials are safe based on very outdated, no longer relevant assumptions. And this simply isn't good enough and doesn't do justice to all the scientific developments over the last 66 years. So the time for an update is right now. And then once we have updated and incorporated modern science, you can choose either processed or fresh foods that you prepare yourself. But either way, you won't need to worry about there being hazardous chemicals present in your diet because all your foods come into contact only with fully safe food contact materials that have been properly tested. So this is our vision. And I would like to thank all my colleagues at Food Packaging Forum, some of which you can see here, but there are quite a few more that contributed considerably to this vision and who continue to advocate for the use of modern science and, importantly, who develop this modern science and the tools for policymakers to use. So thank you to all of you for all your hard work. And if you would like to access any of our resources, I invite you to visit our website at foodpackagingforum.org. Apart from our peer-reviewed publications and, of course, the databases, we have many more resources like a monthly free newsletter that you can subscribe to by email so you can keep up to date with any developments in the food contact world. And with that, I thank you for your attention and I look forward to the discussion. Thanks. Back to you, Jerry.
Okay, Jane, thank you very much. That was terrific. So what I got out of this is that at the Food Packaging Forum, you guys really, you have a plan in general, at least, on how to move forward. You know the chemicals, you know the basic diseases you want to test, and using the concept of key characteristics, you can see the kind of tests that are out there to move forward. The problem is how, and you alluded to it, but how do you move forward? So there's so many questions. I mean, who's going to prioritize the chemicals, and then who's going to set up the assays, and who's going to pay for all the assays, and on and on and on. So yeah. Do you have more of a next 5-year plan that you can tell us how to achieve some of this?
Well, Jerry, you being a member of the Food Packaging Forum Scientific Advisory Board and contributor to this vision, you know that this is a lot of work. It's basically a whole project, maybe even the whole organization in itself that we need to produce here to take this and run with it. And we're in the process of developing a roadmap. So that's our goal for this year. So if you ask me in a year's time, where do you want to be in 5 years? Hopefully I can show you a nice spreadsheet or infographic that will detail exactly these are the work packages and this is how we get there. But for now, we're basically putting out our feelers. We're looking for partners. We're looking for funders. But we're also looking for industry partners or testing lab partners, other scientists, civil society, and so on to join us, people who support this vision and who want to collaborate and who will help us shape the journey for the next 5 years. So that's what I can tell you right now. We can't do it on our own at Food Packaging Forum. We do not have the know-how and we do not have the resources to do it all on our own.
Okay, thanks. That's very helpful. So there are quite a few questions here, and the first question sort of has to do with what we just talked about, how do you really change policy? How do you get the FDA to update that 1958 and to use modern science? There are chemicals out there now, like the phthalates and bisphenols and perfluorinated chemicals that it seems the whole world knows are toxic chemicals, and yet they're in food contact materials, and the government doesn't seem to do anything. If at that level they're not doing anything, it seems like we're really up against the hard wall here to get changes made.
Yeah, that's a really important question. It's in a way deeply philosophical. So let me just start by saying I'm not an advocate. I don't know how to change policy. I'm a scientist. I work at the science policy interface. I do science for policy, but I don't do advocacy. So I'm offering the best science I can to those people who know how to do the policy work, and with an invitation to collaborate with us. And I mean, it does resonate with me. If you look at bisphenol A, it was, I think, 1992 or 1993, the paper was published showing that BPA leaches from polycarbonate plastic, and it's endocrine, it's estrogenic, so an endocrine disruptor. And 2022, last year, at least in Europe, BPA was finally recognized by an official authority as being very, very hazardous at very, very low levels. And so, I mean, that's 30 years, right? That's too long. It's too long to go from the bench to the policymakers. So I think we do need some political scientists maybe to help us understand how we can speed up that process. But my hunch is, and I'm speaking as a citizen now, money makes the world go round. And unfortunately, money also makes the world go around the bend sometimes. And because these chemicals are highly profitable and the materials that they make are highly, highly useful, and the materials that they make are actually essential in a way, they're enablers for highly profitable business models like big food, right? Big food that packages processed foods in these materials. It's very hard to get rid of them from one day to the next. Obviously, you can't just ban a material or a chemical from one day to the next if it fulfills a very important function to society. So you have to make sure that you have alternatives, replacements, and so on. Yeah, so that's not an answer, but those are just a few thoughts.
Yeah, thanks. So there are several questions related to this part. So if there's thousands of chemicals that are leaching that you think might be toxic, do you also have a list of food contact chemicals that are safe?
That's a good one. So sort of the knee-jerk reaction would be those that aren't hazardous are safe. But you can't, that doesn't work that way, unfortunately, because in order to prove safety, you need to do much, much more than to show that something is hazardous. And that's exactly the point of this vision. What tests do we need to be confident as scientists that chemicals and materials are safe? And so that's exactly the idea of putting together this battery of in vitro assays that you can use to screen the chemicals that leach out of materials. You can use it to screen individual chemicals that you use to make the materials. And once you've, first of all, put together that battery of assays, and then you've screened in an appropriate way, and then you don't have any positive findings, which means they don't activate any receptors or whatever, they don't have molecular properties that would be of concern, then you can say that's a safe chemical. So right now, I can't pull out a list of safe chemicals because we don't have the procedures in place yet for testing them. But hopefully in 5 years, who knows, maybe we do.
Okay, great. So all of the assays that you talked about from the key characteristics assays are all in vitro assays. And so what if all of those assays are negative? Would that be enough? Because you're not looking at developmental exposure and epigenetic changes that could occur there. How would you have to add that aspect to this?
Yeah, that's a really good point. I've been thinking about that myself. I think those actually are aspects that could be still currently missing. So we'd have to really make sure once we come up with the concrete list of assays, that we're covering those aspects. I do know that some folks are working on in vitro developmental neurotoxicity assays, for example, and there also are some in vitro assays for certain epigenetic mechanisms. So anything that is coming forward on that front would be really interesting to look at. One of the aspects that I actually also thought about that our vision doesn't capture is micro and nanoplastics. So we know now with increasing evidence that the normal intended use of plastic packaging, plastic food packaging, actually generates micro and nanoplastics. So think of unscrewing that plastic bottle cap on your plastic bottle, or tearing open plastic, or cutting it open, or whatever way you open these packages. Or even heating foods in plastic, like in a tea bag, a plastic tea bag. And this can generate micro and nanoplastics, which will then get into the food. And that's a different type of assay, I think, that one would need to do there. So one set of assays tests would be really to look at the molecular properties of the chemicals that are migrating, and then another study would be to look at the inertness, if you wish, of the material. So how durable is the material? And that should also be factored in as a safety requirement.
Yeah, thanks. I was just going to ask you about micro and nanoplastics. Just this morning, I read an article that they took bottles of water from Walmart and they found an average of 250,000 little particles of micro and nanoplastics in a bottle. So this stuff, the more you test and you think you're getting a handle on it, more chemicals keep coming into the focus.
Well, in a way, Jerry, that's actually a nice analogy to 1958 and the Food Additive Amendment Act, because then at the time people still thought, 60 ppm, that's a really low threshold. That's 60 milligrams per kilogram food. And now we know that that's actually really, really high. And that's because the analytical methods have improved dramatically over the last 6 to 6 years. And it's the same now with micro and nanoplastics. The study that you're referring to, they also used a novel method. And there they just get a much lower limit of detection, especially for the nanoplastics. Yeah.
There's a statement here that I thought was interesting. Washington State just passed a law that requires all food containers and food products must be tested before introduced into the market. Wow, I don't know what they'll do with that, but it certainly is a start. So all of a sudden we have a lot of questions. There's over 20 and I couldn't get to all of them, but we're currently out of time. So let me thank you, Jane. Again, that was just a terrific presentation. And now I'll turn it back to Kristen.
Thanks, Jerry. Thanks, everyone.
Thank you so much, Jerry, and thank you so much, Jane. That was a really wonderful presentation, and we're so grateful for all the work that you're doing on this issue. Thank you very much. Yeah, and also thank you for all the really excellent questions that people put into the Q&A box. We'll go over that list of questions and see whether it might be possible to send out a few more answers afterwards. So I'm just going to wrap up with a few quick announcements. A video recording will be available on Che's website soon, and you will all receive an email with a link to the video. We encourage you to support the work of any and all of the groups involved in the EDC Strategies Partnership. You'll find links to each group on Che's partnerships page. If you appreciate these webinars, please consider a tax-deductible donation to Che and/or any of these partners. We also invite you to join us for upcoming webinars. On January 25th at 11 a.m. Pacific, 2 p.m. Eastern, we'll have our next Che Cafe, Multi-Solving for Climate, Chemicals, and Health. And I just put that link into the chat a moment ago for anybody who needs that. With that, we'd like to thank you again very much for joining us today. Thanks again to Dr. Muncke for her excellent research and presentation, and for taking the time to talk with us today. And thanks very much to Che Director Kristen Schaefer for her support behind the scenes.